Welcome to Marian Ayurveda. In this episode, we are going to think about whether it is possible to reverse a disc bulge to its original state. This is a doubt that many people have, and in the beginning, it was a big question for me as well, whether it is possible to restore it to its original condition. Today, I have a clear answer to that question. In this episode, we are going to discuss exactly what happens in such a situation. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. Before we can answer whether a disc bulge can be restored to its original state or not, we first need to understand one thing. What is a disc and how is it formed? We know that a disc is made up of three types of structures in its entirety and proper form. One is a part called the nucleus pulposus, the second is a part called the annulus fibrosus, and the third is a part called the end plate. It is when these three parts come together that it is called a disc. If we try to understand what the nucleus pulposus is, it's like the moist center inside a sweet called center fresh. Similarly, the nucleus pulposus is a component, a substance found inside just like that. It is a jelly-like structure. It is mainly made up of this water content. It contains about 60 to 80% water content. Surrounding it is a part called the annulus pulposus, which is made up of 6 layers. It is this that gives the disc flexibility at the front. The annulus fibrosus is what provides flexibility to the disc. The end plates at the back are what provide the necessary portion for the disc. These three parts together make up the disc. So what happens in this? In disc bulge, wherever you search, you will find that we often say dehydrated disc. When it comes to dehydration or hydration of the disc, it refers to the water content. The loss of water content is said to be the most important cause of disc bulge. Once we understand this anatomy or pathology, the treatment I follow for disc bulge is based on that understanding. So often when people have disc bulge, if there is numbness in the hands or legs, or if the pain radiates to the leg, they experience numbness in the leg. To be honest, that is actually an incorrect treatment. Even if the pain is in the leg, the actual problem lies in the disc. Why do we say the disc has bulged? Think of a green plant. When a plant dries up, it becomes brittle and looks like it's broken. But if it still has moisture, it remains flexible. It bulges outward towards the front or comes backward. This happens when it loses moisture and can no longer stay in place. The same thing happens in the disc as well. When the disc loses its moisture, that's when it cracks and bulges out. So at the level of treatment, what we need to do is provide enough hydration, enough water to the disc. That is what we as practitioners can do at our level. We know that the disc is not something we can access easily from the surface of the skin. The disc is an organ, or rather a structure that is located very deep inside. It is not possible for us to deliver moisture to it that quickly. So in Ayurveda, the method I use is to look at the MRI, identify which discs are bulging, and then, in a targeted manner, deliver treatment, specifically oil, directly to those discs. It is through this oil that we provide moisture to the disc itself. But it's not possible for the oil or the moisture in the oil to reach there in just one day. When we treat the oil in a special way, adjusting it to a specific temperature and applying it to that point, by the 8th or 9th day, patients start to say that they are beginning to notice small changes, that there is a feeling as if something has been released there. So what I understand is that by the 8th or 9th day, the oil component gradually seeps down and reaches the disc. It is believed that the lost moisture is restored to the disc. Even though this is the theory we see in the treatment we provide, we need evidence for this. Then one day, a patient came to me and asked, "Doctor, has this healed? He is a Navy officer. Has it healed or not? Because of this disc bulge, I am unable to join my job. How can I know whether it has healed or not?" I said, let's take an MRI and find out for sure. So he had already taken an MRI earlier. After about 15 or 20 days of treatment, when he came back, he took a second repeated MRI. I can show you that MRI now in the video. I can show you the position of the disc at the start of the treatment and the MRI film taken after about 10 or 20 days of treatment. We can very clearly see that the disc, which was pressing on the nerves, has moved back inside. When we see in that MRI that it has returned to its original position, about 70 to 80% of the pressure and compression on the nerve has been relieved. So what we understand from this is that with this theory and the treatment we are talking about, we are able to move the disc back to its original position, or at least to a certain extent towards its original position. This is what I refer to as my experience. The second experience I want to share is about a person, a man, a farmer. This person had a disc bulge and was unable to walk as both his legs had become weak and he couldn't walk. His wife came and said that it was a situation where it was not possible to bring him to the clinic. So we sent the medicines to his home, to that place. His wife did everything as instructed. Gradually, step by step, this man reached a stage where he could get up and walk. That's how he was able to come to the clinic. So after he came to the clinic, we treated him, and this is something that happened about 4 years ago. When we looked at his MRI, it showed a condition called disc herniation. That is, disc herniation refers to the condition where the part called the nucleus pulposus of the disc pushes through the annulus fibrosus and protrudes outward like a tear coming out. So this is the kind of condition that was seen in this man's MRI. So once this anatomical annulus fibrosus is torn, I don't believe there is anything we can do to reattach or restore it. However, even so, the change that occurred in this man is truly astonishing. A man who was bedridden before treatment is now able to run around without any pain. So that gave me hope. I told them, let's do an MRI and see what changes have occurred in the MRI. When I did another MRI for this person, I said, it's exactly like the first MRI, even after the treatment, even in the MRI taken after 1 month. But the fact is that all his symptoms had completely disappeared. I still don't clearly understand why that happened or what exactly occurred there. Anyway, some new neuronal pathways or alternative routes for the nerves must have developed or something like that happened. But the herniation remains exactly the same in the MRI. But the fact is that all of the patient's symptoms have completely disappeared. So what I understand is that for changes to appear in the MRI, in cases where the annulus fibrosus has ruptured like that, or in cases with disc herniation, we will never see any changes in the MRI. One point is that it is not possible to restore the disc to its original state. The second point is that in the case of disc herniation, there is scope for treatment, but it is never possible to return the disc to its original state. There is always a risk there. If you ask whether we get a complete result or not, it is a situation where some people may get it and some may not. That is the nature of disc herniation. So when it comes to disc bulge, I am very optimistic. Disc bulge and disc protrusion, these two conditions generally do not cause us much trouble. There are results in herniation, but at the same time, even with disc herniation, there is no situation where we can give a definite assurance. So this is about disc bulge. My clinical experience regarding the question of whether a disc bulge, as we discussed in the first question, can be completely cured or not. We can meet again in another episode. Thank you.